Welcome to Windsor Regional Hospital's Emergency Department. This short video will explain what you can expect during your visit. Your care will start at triage, where patients are assessed and evaluated for urgency. The triage nurse will ask you questions about why you are visiting the emergency department, your medical history, allergies, and hand you a clipboard where you can report any medications that you are taking. You will also be asked to present your health card. Please provide us with an up-to-date list of medications that you are taking, along with the dosages and the times you take them. The nurse will complete a brief history of your present problem and may need to take your blood pressure, heart rate, and temperature. You will then be referred to the registration clerk for completion of your chart. A nurse may be able to start some tests while you wait to see the doctor or nurse practitioner. This will assist us in diagnosing your problem while trying to keep your time spent in the emergency department as short as possible. We know that waiting can be difficult. Please know that delays often occur when patients arrive at the emergency department with critical, life-threatening injuries. When possible, we will try to inform you of these delays. Please note that some patients may also be waiting for appointments in other areas of the hospital. In an effort to reduce the amount of time you wait, our process now has more chairs for patients inside the department, which allows more patients to be inside the ED at any one time. You will also find that during your visit, you will be moving around to different areas of the department, which aims to improve the flow of patients through the emergency department by making the most efficient use of space. Once inside the ED, you will likely be directed to a chair following your initial assessment. A doctor may have ordered further tests or treatments, which will be carried out by various members of our healthcare team. With the goal of improving your ED experience in the shortest time possible, you may be moved to a treatment area for initial management of your medical concern, and then a different area for ongoing care while waiting for the results of tests. Waiting in either a chair or stretcher has no bearing on wait time or priority, and is a decision made by the healthcare team based on the patient's condition. Patients may be asked to move from a chair to a stretcher or from a stretcher to a chair based on the nature of care to be provided. If you have a question or concern, please ask a member of the healthcare team. While an assessment by a physician will take place in a private area, following the initial assessment, most patients will be moved back to a chair or recliner. You may be seated beside or near other patients. We will do our best to ensure privacy, but if you have any concerns, please ask to speak with an ED staff member. We do need to eliminate unnecessary tests, as this prolongs ED wait times for all patients. Any tests which are not emergencies will be deferred to a patient's family physician, or you may be booked as an outpatient. If at any time you are concerned that your condition is worsening, please report any changes to the triage nurse. For your convenience, our emergency department waiting rooms offer Wi-Fi access, televisions, and a bell phone. Cell phone use is also permitted. If you have to leave the ED for any reason, please check with the triage nurse first. Both the Met and Ouellette campuses have areas where food can be purchased. Please check with staff for hours and locations. If you wish to eat or drink something while you wait, always check with the nurse first. You may be asked not to eat or drink if certain tests need to be ordered. Eating or drinking may cause a test to be delayed, creating a longer stay for you. In an effort to deliver timely care and protect patient privacy, we ask that each patient has only one visitor. After you've been seen by a doctor or nurse practitioner, you may be referred to another area of the hospital, admitted, referred to your primary care provider, or sent home. You may also be provided with prescriptions or other referrals. Please note, prescriptions are only provided if the emergency room doctor believes they are warranted based on the condition of the patient. ER physicians cannot replace lost pills, lost prescriptions, or renew prescriptions for narcotics, benzodiazepines, or controlled substances. These types of prescriptions are the responsibility of the doctor who originally prescribed you these medications. If you don't have a family doctor, please let us know. Healthcare Connect can help you access local family doctors. You can register by calling 1-800-445-1822 or online at www.health.gov.on.ca. Our staff will be happy to provide you with information and a list of accepting physicians or nurse practitioners and information on the Windsor Family Health Team. When it is time for you to leave the emergency department, a nurse will explain discharge information to you. Please feel comfortable in asking our staff any questions you may have. Our staff is here to assist you and to ensure that you receive outstanding care, no exceptions.